Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we're one of the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to stop pain, exercise your pain away, science says. It's like Simon says.
Right.
Science.
What we have is some really good research here that is going to show you that you can manage your pain through exercise if done appropriately.
And I think we've seen this from many sources. We're going to mention some today, but I've seen it beyond that even. I mean,
Sure.
It's a commonly accepted concept.
Sure. Mm-hmm.
Try to say that 3 times fast.
There you go.
All right, Brad. So before we do that,
yeah.
if you are new to our channel, if you please subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Look at this. He comes in. And we're also on a lot of different media platforms, social media platforms. If you want to join us on Instagram, we're on Official Bob and Brad. You want to join us on Facebook, we're on Bob and Brad. We're on Twitter, PT Famous. And we have a website, Bob and Brad.
Boy, there's a lot of options there,
Yeah,
Bob.
there you go.
There's no excuses for not to be joining us.
As Brad said, we're like gnats.
Flying around.
Yeah.
So, there might be places that don't have gnats. They're
there
around here, though. Anyways, let's get on with the program, Bob.
Okay.
Pain. Now, this is oftentimes, it can be pain after an injury or a surgery and you're rehabbing to get back into motion, or it can be chronic pain like from arthritis or fibromyalgia, things like that, things can happen and you get pain and then you're afraid actually to move because you can relate that movement to the pain that you experienced before.
And I would say the other thing that can happen, some people, their nerves become hypersensitive. So,
Sure.
they what their injury is, or they maybe don't even have an injury anymore, but the nerves are overreacting and they're sending a pain signal to your brain, even though you really are no longer injured.
Right.
So that's why it's nice to get this movement going and get the confidence knowing that, hey, I can move it without increased pain.
Right. So the whole thing is education, and they've studied this on numerous times where without using pain meds or exercise, but just educating the patient or the individual that's trying to manage their pain, educate them on how the body works. And actually, what Bob had mentioned, they mentioned that doesn't work. Like if you hurt your hand or you got elbow pain, the elbow doesn't send a pain message to your body. It sends information, and then your mind translates
interprets it
into pain.
Right, and with some people, they might interpret it as like, oh, that's really not painful.
Sure.
And others are going to say, that really hurts.
Right.
So, what we're trying to do is we're trying to get your mind, the nerve to send you the message like, yeah, it's okay. I'm getting movement. I'm getting blood flow to it.
Sure.
If there is an injury, it's starting to heal.
And to really get this understood, and if you really want to conquer, if you're one of these people with chronic pain, it really is helpful to read a book on it, or even do something more in depth than what we can do in a few minutes here.
So you want to mention the one book first, Brad, that we don't have here.
Right. It's called Explain Pain, and that's by Larimer, Mosley, and David Butler. So Mosley and Butler are the authors. Explain Pain.
And Butler is, I don't know if you recall, Brad. I mean, he's been in the therapy world for years.
Sure.
I mean, really one of the experts on pain and its management. So that's I would highly recommend that book.
And these are some books that we've used in the past that we've read in for reference.
Paindemic. We've recommended this one, Melissa Cady. She's a DO. It's got some excellent advice, and she goes into some of the exercises that you can actually do.
Sure.
With this book, and
Adrian Lowe.
Yep, Adrian Lowe. He's got a whole series of books on pain and the hypersensitive nerves, and he does a great job of explaining it.
Right, some good analogies and diagrams, so you can relate to it.
This one's called Your Fibromyalgia workbook, but he's got a whole series of books.
Right.
So.
And they do a nice job of explaining it to the layperson, so it's easy to understand. You don't have to know some of these long terms.
Probably better than we're doing right now.
Exactly.
So, you're going to kind of show a series, right, Brad, of things you can start, exercise.
Right. So with movement, that's the next step. They talk about exercising, like the title says. We get the education, then how do we move, and then like how many repetitions or when do we do it? So that's what I want to get into now. For example, if you have shoulder pain, okay, and you're not unable to lift it up to here because it's painful, you need to get over that that shock that you know if it, because over the last 3 weeks before, say you had a sling on it, you knew that it was extremely painful to hear. So you take the sling off, and you're just terrified.
You're anxious.
Anxious, right? Yep, just like, oh, it's going to hurt to do that. So we need to teach the mind that it's going to be okay. So one thing that therapy oftentimes uses to get you started is some pulleys.
Right.
So we need to start with graded resistance or no resistance. In this case, we'll start with no resistance. And then the range of motion needs to be graded. In other words, you know, I never have a patient with a shoulder problem like that and say, okay, start working the pulleys,
right.
you know, and I'm not going to do that because they're just going to,
right.
They're not going to walk out the door. They're going to run out the door.
Yeah, they won't come back.
Exactly. So if this is a sore shoulder, I'll lower that down. I'll say, just put your hand in there and just relax it. Now take your other arm and just gently work it. And you're just maybe start with a few inches of movement.
And that's what I do. I'll start with just small oscillations. Right. And they've got to definitely be told that, because most people right away try to go the full range.
Right.
It's like, you might do this for a couple days. I mean,
right, not straight.
Not straight.
Yeah. So the repetitions, we're going to shoot for 30 of them, and then take a little break, and then do another set of 30, but try and go a little bit higher.
And what I might even do, Brad, sometimes I might do one set of 30 the first day, and then say, hey, see how it responded.
Right.
To make sure it doesn't get too sore.
That's a good point. So it's you gently introduce movement, and then once you start getting confidence, and it's like, oh, yeah, it was a little sore.
I can move it.
Right.
Yeah.
It's not so bad.
It's not going to break.
Yeah. And that psychological aspect can really break through things.
That's exactly right. People feel like, you know, my shoulder, my back, or whatever is injured and I can't move it. But if you don't move it, it gets worse.
Sure. Right. So once you get to the point where, oh, wow, this isn't so bad, and you're really, then all of a sudden you think, well, I need a little more resistance. I got full range of motion. It doesn't hurt yet. I want to get this arm a little bit stronger. But at the same time, doing this still hurts.
Sure.
So we do not want to get after it that quickly yet and start lifting weights. We're going to use either a cane, or we can use like the Booyah stick that we have. A little longer stick works better in most cases. Now I'm just going to start my strong arm. I'm going to take my weak arm. You can put it over the top of the stick or just grab on, and then we're just going to gently start working it here, up and down. And as the arm feels stronger, instead of just letting the sore arm go for the ride, we're actually going to
make it work a little bit.
Yep, make it work. And the other one is just going to help as needed. Now you can do it this way, or when it gets stronger, then you can just go this way, and that's a little more resistance.
Yeah. Now the left arm is not helping the right arm as much.
Right.
So and you definitely have to do some lifting with the right arm.
Sure.
So again, it's nice progression from getting help to, you know, kind of just getting a little bit of help, and then getting almost no help.
Right. And little things like you can put your hands closer together, and then the strong arm is helping more. And as you go wider apart, that weak arm is doing more work. So little tricks like that a therapist will help you out with. Again, we're still shooting for 3 sets of 30, still low repetition or high repetition with low resistance. And for chronic pain people, that's as far as you're going to go. You're not going to start lifting, go up to 5 or 6 pounds and getting stronger, because that's not the goal. You know, if it's after an injury and you want to get back to what you were doing before the injury, that's where we kind of stop at this video.
And you can do this with pretty much every body part.
Sure.
I mean, you know, even your back, you know, you can start off with just getting some movement, laying on your back. If I want to get some movement in my back, I might just start with the rotations here.
Right, getting a little motion going.
Get a little motion, and if one direction hurts, I won't do that direction, or maybe I'll go the other direction.
Sure.
By really small oscillations, and then eventually you can work to larger oscillations, where you're actually the muscles have to work a little bit too.
Sure.
By you know, doing this action. So, and then you can move into some other back exercises with a little bit of oscillation and a little strengthening.
So the whole concept is do some movement that can be pain-free, low resistance, and that higher repetition. So very good. I think you're going to
want to get things moving.
Yep.
That's universal.
Mm-hmm. Movement, education, and there you go.
All right. Thanks for watching.